So why are so many young Canadians getting cancer? The truth is we don't know. We haven't done enough research in this space, but we do know the numbers are rising. I remember when I was diagnosed with cancer. I just finished my doctorate. I'd hiked the West Coast Trail to celebrate. The next day, I had a biopsy. The following day, I had cancer. I had non-Hodgkin's follicular lymphoma, a type of cancer that affects the lymph nodes and that generally affects people who are over 60 years of age. I was 34. I was thrust into a cancer care system that is not designed for young people. I remember being in chemo, surrounded by people who could be my grandparents. I asked questions about fertility, and the response I got was, "We don't know. We don't know if this treatment affects your fertility. Most of our patients are over 60. As I navigated the system and I talked to other young adults, it became clear that the system isn't designed for young people. And that's when I established the Anew Research Collective, which is really focused on transforming cancer care with and for young adults. Talking with other young adults, we're trying to figure out what is it they need, what information is lacking, and how do we create a more cohesive system for young people as they navigate the cancer care system. So we're seeing rises in cancer in ways that we haven't seen with young people. So in the last couple of decades, we've seen cancers rise 79% in adolescents and young adults. And we're really seeing spikes in colorectal cancer, but also in breast cancer, testicular cancer, and others. We don't know why. Less than 1% of research funding is focused on adolescent and young adult cancer. 1%. They're suggesting maybe it's microplastics, maybe it's diet, maybe it's stress, but the reality is we just don't know. What we do know is that cancer in young adults is different. Young people have different needs, and we need to understand cancer in young adults and design something that best responds to them. In Europe, in Australia, in the US, we're seeing dedicated programs for young adults as they navigate cancer. Clinicians are receiving training and expertise so that they can treat cancers in young people. In Canada, we're slowly seeing this. So we've got programs now in Toronto, in Alberta, in Manitoba, who are offering these services. In BC, we're just launching something in collaboration with BC Cancer and BC Children's Hospital and others. And when I say others, with young people themselves. One of the things that we keep hearing about that's important is how do we offer childcare for young adults as they're navigating treatment? What does that look like? How do we offer fertility support? How do we ensure that clinicians understand the needs and the medical challenges for young people? We've still got lots of work to do, but what excites me is that there's so much momentum building amongst care providers, amongst young people, amongst funders to actually support work in this area because the numbers are rising, we need to do things differently, and now is the time, and the only way we can do it is really if we do it together.